instrument to work some soft tissue on yourself. So on most instruments, we're going to have a flat side and a beveled side. And some instruments we have a concave and a convex side. Concave is going to be less aggressive. Convex is going to be more aggressive. Okay. I'm just going to show you over my clothes, but when you do it, you're going to want to do it on bare skin with some kind of lubricant so that you don't hurt your skin. If this causes any extreme bruising, any extreme redness, pain, just stop. Don't go over any open wounds or over any bruises that you already have, and then just make sure with your healthcare professional that you're okay to do this before you do it. So it's pretty simple. So if I was having some like lateral elbow pain or forearm pain or wrist pain, I might take this through the whole muscle belly. Muscles are really easy to find. Like, just look up forearm muscles and you're gonna follow the fiber direction. So the way that the little muscles come together all the way down. Okay, so we're gonna take it, and usually we go from proximal to distal, so from higher to lower to start. And you wanna pick kind of a little bit of uncomfortable amount of pressure, but something tolerable. And we drive in and down, and we're holding that beveled edge at a 45 to 60 degree angle. As we go, pressure down, smooth drag back up, pressure down, smooth drag back up. And you'll feel some gritty spots. That's kind of where you need some more attention. Just nice and easy. You know, some places say, 3 or 4 strokes per segment of your arm. Just do what feels good to you. Like I said, be aware of like that redness or like the little red dots. It's called petechiae. We don't want too much of that. And you're probably going to bruise if you get too many of those. And then we're going to go from distal to proximal in the same fashion. Right back up. This works the same for our leg, right? So if we want to work our quad, we're going to go from proximal to distal first. That muscle, and then we can go distal to proximal. Now, at the insertions, or where our muscles become tendons that attach to the bone, we got to be a little more careful not to irritate our articular tissues. For patellar tendons, pretty easy. We're just going to feel our kneecap and go down to the bone in our tibia, called our tibial tubercle, and we can just work that just a little bit. Usually it doesn't feel as bad. But there are some tissues like your fat pad and your synovium, which is the joint capsule, that can get irritated if you put too much pressure around the joints. So just be careful with that. And that's how you're going to work your instrument assisted soft tissue.